Hello out there in television land. Welcome to yet another edition of It's Your Health, the spring version. I'm here with the Fipster as our co-pilot to guide you through the mazes and whirlwind of healthcare that's out there in today. But make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Remember, it's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the first segment of It's Your Health. Philip Benyo with Philip Benyo. Yes, you are seeing double. And before we begin, kudos are in order. My fit son has just gotten certification in what? Do you want to tell us a little bit more about it?
About a month ago, I went to CrossFit Pittsburgh and attended the CrossFit Level 1 certification class. And it's a 2-day course of instruction and demonstration, as well as testing for various different things that we do in the CrossFit world. And I was able to pass my test, and now I have my CrossFit Level 1 exam passed, and I can teach CrossFit classes, and now I am. I teach 6 to 10 classes a week down at CrossFit Drums, usually on Wednesday mornings and sometimes nights, as well as Friday afternoons. So when I'm not able to work and I'm busy, I'm usually I'm making other people work.
There you go. The apple doesn't fall far from the tree. Is that right?
That's right.
Let's get started.
Alrighty. With that in mind, we're going to talk a little bit about obesity. So obesity, strongly linked to 11 different types of cancer.
Wow. You want to elaborate a little bit more upon that as to what types of cancer, what's the reason?
Well, what they had showed is that there's a lot of different types of cancers: breast, ovarian, colon, rectal, pancreatic cancers, including bone marrow cancers, interestingly enough. That there's a much higher incidence of these cancers in patients who are over their ideal BMI of about 25 or 30.
Wow. Well, it's something to keep in mind, and hopefully that risk would go down as you eliminate that issue as well.
Yeah, we may have some links to that later on. And then kind of going against the obesity curve is obese couples take longer to conceive.
Again, besides the mechanical issues, there are probably hormonal issues as well, and maybe the body kind of knows what it's doing and saying, listen, we're not going to conceive a child under these circumstances, especially if there's a risk of hypertension, diabetes in these individuals.
Yeah, there's certainly, especially from the female, there's, the obesity has higher levels of testosterone sometimes being produced, and that offsets the ability to conceive.
Right.
So we see a lot of that more and more. Lastly, third headline, weak thigh muscles tied to knee osteoarthritis in women.
We see more and more knee issues. Again, if people are overweight, the major weight-bearing joint may not necessarily be the hip, it is the knee. And hopefully there's exercises that you say will help in this regard.
Well, I think that's the biggest myth. A lot of people over years have said, geez, I have bad knees, I shouldn't squat, I shouldn't do exercises to strengthen my legs because I have bad knees. But one would argue the reason we have bad knees is because we haven't done that. The things that we use to extend, our quads and what flex our hamstrings, having good strength in those areas will actually help stabilize that joint. If we have pretty loose muscles there, we get a relatively instability that's going to start allowing these spurs to knock in each other and ripping off pieces of cartilage, ripping up our meniscus. If we have better stability around that joint and we strengthen it, we actually can help improve and prevent arthritis.
Well, again, exercise is your best medicine. Now that goes for osteoarthritis. Can you comment, Phil, a little bit on osteoporosis, because that's thinning of the bone. Exercise, of course, is going to play a key role in the prevention of that disease. Again,
same thing. We used to always say, I'll hear patients say, geez, my bones are thin, I can't do this, I can't do that because I don't want to break something. Well, it's the inactivity and the lack of bone stimulation that's causing those bones in part to be thinner and thinner, and so weight-bearing exercises are important. And I'm actually talking with weights. It's important to do that.
Sure. Very good.
So moving on, more and more we're seeing e-cigarettes and people using vapes and other forms of nicotine replacement. And people are quitting smoking, which I applaud, that's wonderful, but then we're kind of like robbing from Peter to pay Paul. And so they actually did a study that compared nicotine and carcinogen exposure, comparing nicotine replacements such as patches, gums, lozenges, inhalers, versus conventional vaping. And it was very interesting.
And what was the conclusion of this?
Conclusion is the nicotine levels are the same.
Huh.
And whether you're going to smoke or use a nicotine replacement, you're still going to get the same amount of nicotine, which has its own deleterious effects.
Right.
And so really, it's something we have to get the monkey off our back. We have to deal with that addiction and say, I've had it. You know, we're not going to, yeah, did you do a little bit better by getting off the cigarettes? A little. But really, you need to get off this stuff completely.
Yeah, there's no doubt. And smoking cessation is very, very difficult, and a high relapse rate, especially if there's someone around you who's smoking. I often scratched my head and said, if I was an alien coming to this planet and I saw somebody inhaling the exhaust fumes from a car from an exhaust pipe, they would be crazy. But in point of fact, that's cleaner than what we're inhaling with cigarette smoke. It just doesn't make sense.
Moving on, again, more controversial topics, you know, changes in how we think. You know, there's been kind of a change in how we look at prostate cancer once we kind of diagnose that. You know, it used to be conventional, you know, we'd take the prostate right out, and it's a rather brutal surgery, but it cured the disease. Some people had seed implantation versus external beam radiation. You know, can you comment, versus now, doing nothing,
right,
just watching it. Can you comment a little bit on some of the new changes?
Well, it depends, and sometimes it depends on how aggressive the cancer is, so-called Gleason score. That may push you one direction or another. I think the way I would frame it is, what side effects of treatment don't you want? And you know, if you're at a stage of your game where having a personal life and your loss of erections is not a big deal, then you may want to do the surgical route. We've seen problems with radiation therapy. We see problems with almost any type of therapy. It has its own list of side effects, and I think the conclusion is that after it's all said and done, you want to get rid of the cancer, but in the same tone, you don't want to reintroduce side effects which are worse than the cancer itself.
Yeah,
so,
absolutely.
So it's really tough and individualized. So it's, I think you really need some input and do your research and maybe get a second opinion.
Lastly, we'll talk about this very quickly because we're running out of time, is metformin use in prediabetes.
Yeah, you know, how do you define prediabetes, first of all?
Well, we don't use that word anymore because it's simple and easy to understand. This is like the people who are going to be a diabetic, meaning their sugars aren't completely normal, but they're not diagnostic of diabetes. And we've talked about it. You can go on YouTube, pull our old shows where we've talked about it, impaired fasting glucose tolerance, diabetes, and so on. But for these people who I say, you know what, you're not a diabetic yet, but you're going to be a diabetic until you do this, this, and this, you know, and you got to diet and exercise and do this. And for the people who sometimes can't make those lifestyle modifications or choose not to, what we can do is actually we can use medication for that. And although there's none out there that are truly indicated for it, metformin has been shown to be useful in not only helping delay the onset of diabetes, but in some individuals actually prevent it completely, which is kind of new.
Yeah.
You know, metformin is one of those safe medications that we use it in non-diabetic patients all the time for a lot of different uses. So it's certainly not going to drop your sugar too low, but it's something that does have to be monitored.
And it keys in on insulin resistance, which I think is the cornerstone of most of our diabetics that we see. Well, we told you it's the fastest half hour, and we're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo, the Fipster, guiding you through all the landmines.
Cornucopia of medical knowledge.
There you go. I like that. Moving right along. Where are we at here?
Let's get back to those headlines.
Okay.
Nut consumption can decrease the risk of mortality or morbidity in various chronic diseases.
You know, it's getting back to us as being cave dwellers, hunters and gatherers, getting away from processed foods. Nuts have really made a comeback.
Absolutely, and we'll touch on that a little bit later. I have a nice little full screen that we're going to talk about nuts and the omegas and kind of looking back to that more paleo style living and
right,
talk about how we've kind of perverted that over the years. But let's move on. Anti-cancer and cardioprotective effects of aspirin outweigh the risks of GI bleeding?
Great thing. I don't have heart disease, but I take a baby aspirin every day. Am I at risk for developing an ulcer? Sure, but it's probably unlikely. I use the enteric-coated baby aspirin, 81 milligrams every day. I don't bleed anymore in terms of if I cut myself shaving or something like that, but I think it's going to reduce my stroke and heart attack risk. And it's also, according to this, maybe cut down on a cancer risk as well. So aspirin's making a great comeback.
Yeah, it kind of goes back, and we're going to talk about a little bit, it all kind of goes back to inflammation. You know, what can we do to increase inflammation, or how we do that, and then how can we decrease that inflammation, which that's really our goal. It's these inflammatory cascades that are really causing everything.
Right, and then before you start, that's another thing you got to check with your healthcare provider about.
Absolutely. There's certain meds in that won't get along. Okay, lastly, does working out affect testosterone levels?
I wouldn't know, but maybe you can tell me.
Well, the answer is maybe. It depends what kind of exercises we're doing. And sometimes I'll have people who will come to me into the gym and they'll say, geez, I feel like my T's low. And everybody likes to talk about testosterone. Some people are using it illegally. Some people are getting it from prescribers for, quote, low T. That seems to be the newest kind of fatty epidemic in our area, is that because of all the commercial advertising about testosterone, all of a sudden it's a new problem and everybody needs it. So, but there are certainly things you can do to help increase your testosterone, and those are the things that we call increase your neuroendocrine response. And these are the higher weightlifting things that you're using a lot of big muscles quickly. So that's your squats.
Yep.
That's your deadlifts. And even though that sounds like a horrible word, if you pick up groceries off the ground, you just did a deadlift, okay? You just need to do it correctly. That's your snatches, your clean and jerks, the Olympic lifting. Things that produce a lot of energy quickly are going to increase that neuroendocrine response. You'll increase your testosterone, you'll increase human growth hormone, and insulin growth factor, all which help produce muscle. Things like cardio, running, bicep curls, things like that really aren't going to produce the testosterone that you're looking for. So you can control that doing these functional movements.
Holy kettlebells, what can I tell you?
Yeah.
I'm kind of in the eat, drink, and be merry part of my life, to be honest with you, but moving right along.
All righty. Let's get back to food. And, it's springtime. We're starting to look for healthier foods. We're starting to go to the farms. And this was a real surprise list that went over pesticide use in foods. Now, pesticides are used in a lot of different foods, even ones that are claimed to be organic. But here's a list of the top 12 foods that not only have pesticides on them, even after they were washed and peeled, they still found high levels of pesticides in.
Wow, that's a pretty impressive list. And
strawberries tops the list, and that's something we like to use. I certainly think spinach is good for you. Tomatoes are good for you. Bell peppers. These are all things that I like to eat that I consider pretty healthy. But we have to watch. Some of these higher level of pesticides can start to affect our nervous system. Now here, alternatively, is a list of foods that are relatively low in pesticides.
yeah, it's very impressive, Phil. And when you go out to eat and you have a salad with all these things, did they wash the food ahead of time in preparing the salad, as you would perhaps at home? So it's kind of scary out there, and it's just part of being in our industrialized life.
Yeah, I think that's sometimes why it's a good way to try to be a little bit more local with what you're getting, because you can walk up to your local farmer and say, well, what are you using, and find out, are they using stuff, or, is there stuff going on here? And then you'll kind of know a little bit better what to do. But I think inherently that will be better than something that has to be grown who knows where and has to be stabilized in such a way till it gets here. You have more control over your food locally.
Yeah, no, and when I go shopping, I'm always dismayed by seeing that I'm exposed to garlic that's grown in China. Can't we grow garlic here? I mean, give me a break.
You grow it in your yard.
That's right.
We can start having Benyo garlic. We can start selling that at Wise's.
Very good.
Alrighty, very quickly, something very neat article we came across about the risk of osteoporosis with blood thinners such as Pradaxa and Coumadin. Did you get a chance to look at that?
Well, osteoporosis, when you total up diseases like heart attack, stroke, and cancer, they may not even approach the people out there that have osteoporosis. Osteoporosis is an epidemic. as people are living longer. They're on medications such as proton pump inhibitors, for example, that can add to it.
I found that very interesting. What does it mean? Maybe we need to do a better job of looking at the DEXA scans, but it was a surprisingly interesting study.
Well, osteoporosis is not readily diagnosed. It is easily diagnosed, but we don't send patients or push them like we do other screening tests. The DEXA scans are paid by Medicare if you're a postmenopausal woman every 2 years. And we do see osteoporosis in guys. So again, you ought to look at getting the DEXA scan, because once that bone is lost, I can't get it back. And the consequences of a fractured hip or vertebral body is bad.
It's devastating.
It's bad.
It is life-changing.
Yep.
Alrighty, very last quick thing we'll get in before this, our time, I'm getting told that we're running out of time again. It's the same problem.
clock goes
We can
fast.
just keep going. Alrighty, we've talked about this briefly, but you know, they actually did a meta-analysis to look at all the different studies to talk about blood pressure in our more elderly individuals. And what's our target?
Well, what is it? A 140 over 80-ish?
Ideally, less than 150 over 90, whereas if it's someone like yourself or me, we're looking at less than 120 over 80. We want it lower. And
yeah. So the younger you are, the more you can tolerate and should get to goal, lower blood pressure. And as we age, because of a variety of reasons, particularly fall risk, lightheadedness, and dizziness, we kind of let you go up a little bit more on that scale and allow a little bit of a higher blood pressure. So.
Again, fastest segment, fastest half hour on television.
Einstein should know about It's Your Health because time goes fast.
Yeah, it definitely does not equal MC squared. I don't know, there's something wrong.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back to the third and final segment, I can't believe it, of It's Your Health. Philip Benyo with the Fipster, bringing you the latest and greatest.
Alrighty, this will be the interesting headlines part. You know, we say these for the end. Could fading sense of smell mean death is closer?
That's kind of very ominous and odd. Now, the sense of smell, of course, can go down for a variety of reasons. Smoking, you mentioned earlier. Demented people tend to have a decreased sense of smell. But elaborate on this if you don't mind.
Well, I think it's pretty interesting, is they actually have shown that people who start to lose their sense of smell in their 40s or 50s have a higher incidence of early death for a variety of reasons. Now, it doesn't necessarily say why those reasons are, and it's not necessarily dementia, but we actually are starting to come out with protocols that we use the sense of smell to help detect early dementia. You know, there's a peanut butter stick test where, depending how far away you can smell that peanut butter or not smell it, it gives a very good diagnosis of dementia, you know, which is kind of mind-boggling. But what it goes back to is part of your brain not working correctly, and why is that? And so for smokers, loss of sense of smell, well, smokers have a high risk of early death anyway. That's no surprise.
Right.
But that also tells us that if you say you're not a smoker, we have other vascular issues going on in our brain that aren't just affecting your sense of smell. They're affecting other parts of your brain too, as well as other arteries, you know, like in your heart and your kidneys and all over. So
that is
pretty
impressive.
interesting.
That is impressive, and we generally don't think of that in terms of a symptom. So, sense of smell.
Second headline. Hypertension risk soars in offspring who have parents that have early onset hypertension.
Well, again, the apple doesn't fall far from the tree, and I think that can hold true with diabetics. But when we see youngsters in here and we tell them they're pre-hypertensive or hypertensive, they don't believe us. But then when we ask, well, is your mom and dad on blood pressure medication? Yes. And so you throw in that and the lifestyle that the youngster has as opposed to their parents, with salt use and perhaps not being as active.
Absolutely.
And hypertension, I'm sorry, it's one of the most underdiagnosed and undertreated and most lethal diagnoses out there.
Absolutely, and I think, you know, from our standpoint, what I think I will think about doing a better job is not, because I'll ask, well, do your parents have high blood pressure? Well, yeah, I stop there. next thing I have to ask is, well, when did they start taking medication, or how long have they had high blood pressure? Well, they've been on pressure medication since they're 20. Well, geez, that's a big problem. And those people tend to have some pretty jacked up pressure.
Right, and you know, we see not rarely 40, 50-year-olds with intracranial bleeds, strokes, heart attacks. Having a high blood pressure is like putting too much air in your car tire. It's going to wear out and blow out on you.
Alrighty, lastly, this one's kind of a news of the weird. Okay. Study finds that chocolate use is inversely proportional to type 2 diabetes risk.
This is like a tinfoil hat thing, so you got to tell me about this one.
They don't know why, but the study actually looked at dark chocolate consumption, which there's some
dark chocolate.
Dark chocolate has some anti-inflammatory benefits. It has some neat things going on that isn't quite fully understood. But they actually showed 28 grams, which is about a third of a candy bar, by the way. It's not like lots of chocolate, but having 28 grams of dark chocolate a week decreased your risk of diabetes when compared to people who didn't have any chocolate consumption. They had 3, 4, 5-fold increased risk of diabetes.
You know, I told you I'm on the eat, drink, and be merry train, so that's substantial.
Well, it's going to be dark chocolate.
It has to be dark chocolate.
And I think it falls back to, anti-inflammatory cascade versus inflammatory cascade. And so now we've talked about fish oils a lot, but we're going to talk about that a little bit more. And I think what's important to talk about that is you touched on it, caveman or paleo style living. And so one of the things we look at for that is how we handle our fish oil or our fatty acids to begin with, our omega-6s and omega-3 balance. And if we look at our current diet today, the American diet, we have probably omega-6, which is pro-inflammatory, versus omega-3, which is anti-inflammatory. We have a 20-to-1 ratio of that.
Yep.
And if we look at our cavemen ancestors or paleo-style diet, that is a 3-to-1 ratio, which is far more ideal. And so we're consuming high amounts of very pro-inflammatory things. And we're doing a lot of things to increase inflammation, by the way, like smoking, drinking too much. That's part of this. And if we look at this little map, we can see kind of the differences between what we can do to help increase our inflammation or our anti-inflammatory benefit, and then decrease the things that are causing inflammation.
Right, and it's truly a big deal. And I think a lot of our diseases would be forestalled if we got on this omega-3 bandwagon. Fish oils, I think, are terrific. They're underutilized. You need to get a good quality fish oil, not one that is at a discount. If you are getting fish burn or heartburn from this, it's probably a lousy fish oil. The quality ones do not cause that. Spend the money. And you're absolutely right. The omega-6s are lethal. That's sort of the gas pedal of inflammation in our body. The omega-3s are the brakes. And there's actually very little medications that will reduce inflammation other than omega-3s. I mean, it really is, they're very powerful anti-inflammatories, low incidence side effects. It's a no-brainer, no-brainer.
And I think actually, to kind of balance that on the completely, you talked about medications that decrease inflammation. We don't have a lot of conventional ones, but some people say, well, what about anti-inflammatories? Well, what about NSAIDs? What about Celebrex? And these are all prescription anti-inflammatories for joint issues, but what do these medications do?
Well, they'll give you an ulcer. They may screw up your kidney, irreversibly, I might add, and they're going to bite you in the long run, not to go against the people who manufacture those drugs, but they're not for everyone.
And they show that although they may decrease some inflammation in your joints, they actually disrupt the inflammation cascade in your arteries such that it's more pro-inflammatory. These increase stroke and heart attack risk. Yep. And in part because they will inhibit aspirin's protective effects. And so, you can't, the NSAIDs are also part of the problem. And, you talked about high blood pressure, and people who are taking Advils and Fistin, Aleve all the time, they're jacking their pressure, they're causing fluid retention, and you're right, they're causing irreparable kidney damage.
Got to get back to the caveman days.
I got a picture to show you.
All righty, let's go.
So let's just take a look. What do you think?
Yikes. that looks itchy. Tell me more about this, Phil.
Well, it started just out of the clear blue. This is on a person's left thumb. They had, it's rather tender, and now they have little vesicles there, and they were placed on an oral antibiotic, some amoxicillin or clindamycin in the ER because they thought it was maybe a MRSA type infection or almost like an impetigo of the hand, but that didn't work.
So what do you recommend next?
Well, what do you think it is?
I don't know. I have to look at and feel and scratch it and maybe.
Oh my goodness, that's true. Well, this is actually a herpetic infection.
Yes.
So what do we do? What are we going to do to treat that?
Well, you'll put them on something that we would treat herpes with, like a cyclovir, for example. But the vesicles was the key to the diagnosis. Those little rose dewdrop on a rose petal.
Yes.
That's it. Those little vesicles.
Very common. We don't see this as often as others, but sometimes this will be mistaken for a bacterial type cellulitis, and in the MRSA world, people get really upset or worried about this. But these are usually self-limited. They can reoccur.
Right, right. So when in doubt, take it out. Speaking of which, again, here we've gone past the time limit for our It's Your Health. Thank you for allowing us to come into your home, inform, and hopefully entertain you. Happy spring.
That's right.
And thank you for joining us. Remember, we're It's Your Health, your leader in healthcare information. See you soon.